Errors, A Proposal for Change by Isabel, Taylor, Michaela, Sarah and Jared. In the video, there were several events which occurred throughout the scenario which contributed to the final clinical error occurring, which could have potentially caused significant harm to Mrs. Hughes. These events included the failure to follow policies and procedures in regards to the administration of intrathecal medications, Dr. Livingston assuming another doctor's capabilities, the failure of Dr. Livingston to listen or respond to staff concerns about the procedure, and poor communication between all members of staff. There was also an occurrence of improper handovers, running short of time due to unforeseen circumstances, the new doctor's failure to gain legal informed consent from Mrs. Hughes, a number of distractions during administration, such as phone calls in emergency situations, and the failure to involve Mrs. Hughes in her care. One of the most significant events which occurred was the doctor's failure to accurately check the medication following the 7 rights, causing the wrong medication to be administered via the wrong route, possibly leading to a sentinel event. In this proposal, Standard 4 of the National Safety and Quality Health Service Standards, medication safety will be discussed in response to this scenario. The purpose of the medication safety standard is to ensure that all healthcare professionals have the appropriate education, knowledge and training to safely administer medications to patients, as well as implementing strategies to prevent the likelihood of medication errors occurring and monitoring the effectiveness of these strategies. The aim of this proposal is to identify what went wrong within this case, implement interventions to decrease the likelihood of this error happening again, and to investigate if these strategies have made a difference in reducing medication errors within the organisation. The goal of this proposal is to decrease the amount of errors occurring within the healthcare organisation by 30% by implementing strategies discussed within this proposal within the next 6 months.
As stated by the World Health Organization, a medication error is an avoidable event that stems from incorrect medication use while the medication is in the hands of the healthcare professional, which potentially leads to harm to the patient. In this video, the main issue was when the 2 doctors administered the wrong medication via the incorrect route. Medication errors identifies one of the top leading causes of harm to inpatient, as it causes adverse events for the patients involved, therefore potentially increasing hospitalisation, decreased patient satisfaction, or worst case scenario, death. In this specific scenario, it was evident that the doctors handling the intrathecal medication were distracted. They were discussing other patients and were not focusing on the task they were presented with. The doctors failed to complete the 7 rights of medication administration, therefore leading to the incorrect administration of the intrathecal medication for Mrs. Hughes. In a study undertaken by Harkonnen, the staff identified the importance of double-checking medications with other nurses and actively involving patients in their care, as this contributes to a reduction in medication errors. This study suggests that implementing a relaxed working environment into workplaces will reduce future medication errors, as this allows nurses to focus their attention on their current tasks, such as a medication round. There are some interventions that can be put into place in the hospital setting that will decrease the number of medication errors. An appropriate intervention that patients would benefit from during the hospitalisation is involving them in their care, particularly during their medication administration round, as this can contribute to a reduction in medication errors and is a way for patients to be fully engaged in their own care. Generally, if patients are of sound mind, they usually know what medications and dosages they are prescribed. In this scenario, Mrs. Hughes knew and understood what medication she was to have intrathecally, however the doctors failed to involve her before administering. Involving Mrs. Hughes during this time could have prevented the medication error and in turn prevent any future harm that may have occurred to Mrs. Hughes. Standard 2 of the National Safety and Quality Health Service Standards refers to partnering with consumers. This relates to the ability of healthcare organisations to work in partnership with patients, carers and other significant consumers to improve overall safety and quality of care being provided. With reference to the Australian Commission on Safety and Quality in Healthcare, evidence has shown that the partnership between organisations and consumers has had a positive effect for patient satisfaction and improvement in healthcare safety. While this standard is not the main focus of this proposal, it is still applicable in that this standard involves the patient participating in their care, which includes recognition of medications, therefore reducing medication errors. Communication is a key aspect of nursing and is essential in providing adequate care for all patients. If Mrs. Hughes was involved in her care, then this error may not have occurred, as she was familiar with the medications she was on a regular basis. As the doctors were new within the healthcare setting, it would have been appropriate for them to collaborate with Mrs. Hughes to ensure that the correct medication for administration was given. Another intervention that has been put into place in many healthcare facilities is the use of a vest which states "Do not disturb medication round in progress." The concept behind this intervention is to reduce the number of times nurses are interrupted whilst administering medications, therefore reducing the number of medication errors. In order to determine if there has been an improvement in medication errors once these interventions have been put into place, there should be a decreased amount of reports in Riskman. Riskman is an online system used by many organisations that is designed to manage risks, incidents, complaints and claims. If a reduction in medication errors has occurred, the proposed interventions would be deemed successful, thereby allowing the organisations to acknowledge that these interventions have had a positive impact.
When determining the effectiveness of interventions, much like Riskman, a before and after mixed method design study can be performed. In the case of using medication vests, Healthcare organisations can determine the effectiveness of the intervention through analysing the number of interruptions, a distraction by someone else, as well as medication administration errors, a breach in any of the 8 medication administration rights before and after implementation. Data would be gathered over periods and compared to each other. For instance, period 1 would be 1 month without the intervention, and period 2 would be a month after the intervention. In a study conducted in 2012, which analysed the effectiveness of medication vests, it was found that there was a 75% reduction in interruptions and a 66% reduction in medication error. In this example, it is seen that by comparing quantitative data from before and after the implementation of an intervention, the effectiveness of the intervention is determined and deemed effective or ineffective.
In application of these techniques to a hospital, it is important to encourage and maintain behaviours that increase the likelihood of safe medication administration and minimise the risk of human error. This means ritualistic use of medication round vests, which have previously been used in hospitals, to minimise incidents of outside distractions, increasing risk of error. Medical professionals involved in medication administration giving appropriate and accurate education to patients is important for the involvement of patients in their own care. It should be routinely clarified to patients the name, action, and dosage of their medication, further decreasing the risk of errors in medication administration through patient involvement and an informal third party checking the medication prior to its administration. These actions can be supplemented by the use of the Riskman tool to measure and monitor the risks, incidents, complaints, and claims against the category medication administration. All activities in this aspect of professional care should be logged into the Riskman at regular intervals so as to be able to accurately trace trends relating to the medication administration. The use of the Riskman tool, medication vests, and patient involvement in relation to medication administration should also be subject to auditing. An audit is an inspection that is performed and provides information relating to success of patient safety strategies and the upkeep of standard of care in a clinical setting. The use of auditing has been proved to assist in recognizing best practices, their integration, and risk mitigating strategies, which allow hospitals to maintain a quality of care and standard of practice, while continually striving to improve the workforce. By using auditing as a strategy in medication and administration safety along with the other aforementioned safety strategies, it is possible to minimize the risk for the patients and improve the quality of care given in respect to medication administration.
Once the education and implementation of the strategy has been introduced to the healthcare facility and auditing has taken place throughout the specific ward in regard to the safe and effective use of medication vests, then the results should be compiled and investigated. This may involve senior members of staff from the area of nursing coming together to further investigate the results found and take the necessary steps to minimise and reduce the risk of medication errors occurring within the healthcare organisation. Research has shown that senior nurses who have more experience working in the healthcare setting are less likely to make medication errors. In turn, this would lead to the best insight into how to better sustain the proposed strategy, seeing as senior nurses are seen as leaders in their designated ward and may be more perceptive in regard to reasonably altering the areas necessary in a feasible way that is also practical for the ward or department. Moreover, once the investigation into the results has happened at a ward level and a plan has been devised as to how to make realistic improvements to the problems identified, then this proposed strategy could be spread throughout all wards within the healthcare organisation. This could be done through the senior nurses who participated in the first implementation of the strategy, providing an in-house conference for senior nurses of each ward to attend, where they would present the results found and how this can positively impact on safe and effective nursing practice and the minimisation of medication errors. From there, these senior nurses can then tailor certain areas of the proposed strategy to better suit their ward in a way that is practical but still maintains this element of safe practice. For example, for wards that have more beds, this may be having 2 nurses undergo the medication round and wear the Do Not Disturb vests, as this may be more time efficient and there are more nurses available on the ward due to the nurse-to-patient ratio. That is, if there are more nurses on the ward, then having more than one nurse undergo the medication round should not affect the smooth day-to-day operations of the ward. By spreading and sustaining implementation of this strategy, this can positively impact on the number of errors made in regard to patient medication administration and therefore lead to safe and efficient practice of nursing within the healthcare setting. Ultimately, if Dr. Campbell had the correct procedural interventions in place prior to administering the medication for Mrs. Hughes, this could have minimised the risk of a medication error from occurring. Medication errors are a common occurrence in the healthcare setting and are critical to address so as to ensure the safe practice of medicine within the healthcare organisation. By implementing our proposed strategy into a specific ward within the hospital, this can lead to improved results in regards to safe medication administration. If the ward is satisfied and sees this proposed strategy as a viable option for the healthcare organisation to implement, then this can be spread throughout all relevant wards within the healthcare organisation.